Hi, I'm Mike Duggan. I've been teaching restorative dentistry for over 32 years now and to over 6,000 dentists. This video shows how I do it. Real-time, mannequin-based, hands-on, point of view, and patient real. If you are a pre-dental student, an aspiring teacher, an international dentist, join me at Duggan Oral Design, DugganOralDesign.com. I don't normally wear it indoors, but when I'm driving or outdoors or something, you know. All set?
Almost.
Okay. All right.
Oh, wait a minute.
Not so all right.
Almost. Almost all right.
Testing, testing. Cool.
We're rolling.
All right. So that was that as easy as you thought it was going to be?
No.
Like I said, it's challenging. There's a lot of things to keep track of at the same time. So, and what's the first thing on this lower molar prep? We pick up the handpiece, we put a burr in it, we get it going, and we cut something. What are we going to cut first? The grooves on the A-plane. And how many of you did that? So here's the opposing cusp, and you put a groove in over here. Why would you do that? Oh, that's where it was before. So I think a lot of my previous discussion was relevant to, it doesn't matter where it was before. The lab doesn't care where it was before. They only care about where the opposing tooth is. So that's all you care about too. Okay? So cut those grooves, make sure they match the opposing tooth. Use the mirror always to look up in that area. Then you go, okay, now I see it. So you guys are doing the A-plane, and I come around and I show you in the mirror. And then you can see, well, you know, here's the opposing cusp. Your grooves are way over here. Or your grooves are flat instead of making nice grooves. Or your cusps, instead of being rounded, are sharp. So, but if you look in the mirror and you look up that plane and you see this view right here, without the red line, okay, then you go, okay, that looks pretty good. So I want to be able to look at that A-plane and see a nice uniform clearance from the mesial to the distal. You look this way and you see the angle matches the opposing tooth, and you go, all right, got it. Then move on to the next plane. Okay. So A, B, C. The order is pretty easy to remember. It's the same as the alphabet. Okay, so not much difficulty there. A-plane, all those grooves, nice rounded surface. And the B-plane, again, making these flat planes and well-defined ridges. The better defined the ridges, especially this one, if you define that ridge really well by making two nice flat planes, then you can see in the wax where that ridge is, because in fact, you have a ridge. If you just cut it straight across and you don't make a ridge, you look in the wax, you're not oriented. Okay? You take the pencil and you mark that ridge, so now that you've got a cleanly defined ridge and you've marked it with a pencil, then you look at the wax and it's really easy to see what's going on. The other thing you need to remember is, of course, when you put the wax on, put the wax from about here to here. Don't let the wax spill over onto the adjacent tooth. Don't cut it too wide. You see if it's on the adjacent teeth, and the adjacent teeth are coming fully into occlusion, then you have to squeeze the tympanoid down all the way through the wax to zero wax. And that's much harder to do than just squeezing it down until you get, you know, a millimeter or a millimeter and a half, something like that. So you want to keep the wax off of the adjacent teeth that are in full occlusal contact. And then to make sure you do it right, you know, look at the other teeth, make sure they're in the same occlusion with the wax as they were without the wax. Then we're okay. All right? Now the upper prep is a little easier. Sounds nice, huh? Okay, so we're talking about the upper prep, and then we're going to talk about the occlusal reduction first, and then we're going to talk about how to do axial reduction. We're only going to do axial reduction on the lingual surface of these teeth. We're not going to reduce the facial surface. Why? Because we're doing preps that are going to be aesthetic, And we would like the patient's friends not to see any gold, so we're going to not reduce the facial surface. Now, we can do 3/4 crowns that preserve other surfaces for other reasons, but we don't need to go into those right now. If we just assume that we're all doing them for aesthetic purposes, then we know what we're going to do and we know what our goals are. Okay, so let's take a careful look at the upper prep. So we know the anatomy pretty well. And we know that we're going to try to preserve the facial surface. So we want to preserve as much as we can of the facial surface of the tooth and of the facial cusp while we're reducing the occlusal. So we're going to take a pencil and rub it around on this tooth with the pencil horizontal. So it only marks the highest point, right? So the pencil is only going to mark the highest point all the way around this cusp ridge. This is just a guide for you. So take the pencil and rub it around on those cusps, and it's going to mark the highest point right here. So that pencil mark is like a barrier, okay, a boundary. And you want to cut, when you're doing the plane of reduction, that's the A plane of reduction like this. When you're doing the A plane of reduction like this, we're going to make sure we reduce all the way to the pencil mark, all the way to the cusp ridge, but don't go beyond it. Now watch what happens if you're too horizontal. Then you got a problem. We talked about that before, didn't we? If you tell the patient that you're going to do a really sophisticated prep and preserve that facial area so they're not going to see any gold, and you cut it like this, you know, you've got a real problem. So we're going to try to pay careful attention to that when you're doing the occlusal reduction of the upper tooth. Again, put a pencil mark on there so that you've got that barrier, got that visible boundary that you're not going to go past. Now we're going to cut a couple of ridges. A ridge here and a ridge here. And where are we going to put those ridges? We have some choices. We can choose the vertical angle, we can choose the direction, we can choose the position. So that's what we've been talking about down here. So where do you think I should put this ridge? Is there any guideline that we might use? Anything that we might want to use to orient ourselves? Huh?
From the maximum highest, like highest point.
You mean where it was originally?
No. As per the opposing.
Yeah, the opposing groove.
Yeah, we're going to compare it to the groove on the opposing tooth. All right? So it's just the opposite of what we did earlier. Now we're going to make a ridge on the upper tooth, and here's the groove on the lower tooth. We want to position the ridge on the upper tooth so it's fitting the groove on the lower tooth. A little while ago, we cut a groove on the lower tooth to fit the ridge on the upper tooth. Now we're going to put the ridge on the upper tooth wherever it should be to fit the groove on the lower tooth. So we get equal clearance on both sides. Okay, that makes sense. So if I'm going to cut a ridge here, I'm going to check the clearance on both sides, but I'm going to make a flat plane here, flat plane here. I'm going to move the ridge wherever I need to so that it fits exactly into that groove. So I have the same clearance on both sides of that ridge. So now, the clearance to the opposing tooth, normally, since that's a non-functional cusp, normally we'd say, okay, get 1 millimeter of clearance. But this is a situation where we're trying to preserve that buccal cusp ridge, and so that's really important. So we might compromise. We might have a situation in a patient's mouth where there's not as much horizontal overlap, overage as we want. We might have a situation where we have to compromise a little bit on the clearance. So we're going to say the clearance should be at least 0.75. Now, so we'd like to get 1 millimeter, but if we can't, we can keep it a little bit less than that in order to preserve a little bit more the facial cusp ridge. So we're that concerned about the facial cusp ridge preservation. You know, we want to make a crown for a patient that nobody knows is there. All right, so we cut 2 planes and make a nice ridge, position the ridge wherever it needs to be to fit in the opposing groove. We try to get a clearance on both sides of that ridge of, ideally 1 millimeter on both sides. If it's 1 millimeter on both sides, that means the ridge is in the right place, right? We don't need to use bite wax, we can just look at it, this particular one. Now I want to do the same thing over here in the distal buccal cusp. Now we have 2 ridges, we have 4 planes, we have a facial group. Remember, when you cut this plane, come all the way to the marginal ridge, reduce the marginal ridge right next to the adjacent tooth, and then come down this way and bring the end of the burr out of the facial groove. So I was showing everybody how to do that a little while ago. Cut to the cusp ridge, to that pencil mark, but don't go beyond it. And if we can't get quite a millimeter, then get a little bit less than that, but no less than 0.75. Make sure you're reducing the central groove. So make sure we have a central groove that's giving us, or reducing it compared to where it was originally. Then we're in pretty good shape. So the 2 ridges and the 4 planes and the mesial buccal cusp and the distal buccal cusp are pretty easy to position into the opposing tooth if we're paying attention while we're doing it. That's kind of the key, isn't it? Okay, so we have a B plane and a C plane. The B plane now is going to have 2 parts. It's going to have a part here on the mesial buccal cusp, the buccal incline of the mesial buccal cusp. It's going to have another part over here, the buccal incline of the distal buccal cusp. Or, sorry, mesial lingual, distal lingual. So we have to figure out how we're going to cut those. Now, just a reminder, when we cut these planes here, the view that I had when you're looking at this picture, the view that we have when we're looking at this picture, that's the same view you want when you're doing it. In other words, sit behind the patient, look down the axis in the mirror, and you can cut those planes beautifully. Very easy to do. Okay?
Question, why are you not involving oblique ridge, like when you are doing like cutting oblique plane, like the distal lingual cusp?
With this area here?
Yeah.
Oh, we'll get there.
Oh.
So, all I'm going to do, well, let's finish up a little bit on the A plane, because I backstepped a little bit on the A plane, then we'll talk about how to cut the B plane. On the A plane, again, we're using the mirror, we're looking down the axis, we're cutting those 4 planes, we're getting those 2 ridges, keep checking to make sure how it fits the opposing tooth, and we got that done. Almost all of this prep we're going to be doing in the mirror, okay, because it's easier. This part right here, we're going to do by direct vision, because it's easier. So it's one flat plane right there. So, anybody have my type it on? My type it on is probably floating around here somewhere. There we go. So I'm going to sit behind the patient. Thank you. So typically I'm sitting behind the patient like this. I can do everything on the upper arch, sitting behind the patient, but I'm going to turn the patient a little bit like this and lean over a little bit like that. Now I'm looking along the arch. I'm looking pretty much horizontally along the arch. I can see the vertical angle of the burr in this area. So I'm looking along the arch like this. And I've already reduced the marginal ridge with my A-plane, as long as you do reduce the A-plane all the way to the marginal ridge, then start there with the burr at this angle and take the vertical angle from the adjacent tooth or teeth, start right in that marginal ridge and just push it straight away from you. Push it flat all the way through that marginal ridge. I said flat, I didn't say horizontal. Here's the vertical angle you want. So I get the vertical angle from the adjacent tooth. Look along the arch by direct vision, start on the marginal ridge, just push it straight through the oblique ridge, just straight through the oblique ridge. So I'm looking this way, take the vertical angle from the adjacent tooth, and just push it straight through the oblique ridge. Okay? So we're reducing at the marginal ridge, reducing at the oblique ridge, all the way through. We're trying to reduce the oblique ridge. You've been a couple days trying not to reduce it. That's class 2s. That's a whole different thing. We're trying to reduce it. The lab's job is to build it back again. Our job is to reduce it so they can put something on it. and build it back again. So come all the way through. Don't just start saying, oh, I don't want to hit the oblique ridge, I'm going to raise it up. Then you get a real mess, okay? All the way through the oblique ridge. Okay. By direct vision. Then everything else over here, again, we're back to looking down the axis in the mirror. That makes it easier. So I can take the same burr, looking down the axis, and I take this burr and put it right here, cut right into that distal pit. This is where people mess up. Most people get a very nice plane across here at just the right vertical angle, but over here people forget where the distal pit is. Okay? It's way over here. So start with a burr, bang, right down to that pit, and then come up this way. Bang into the pit, come up this way. Bang into the pit, come up this way. Then flip it over into the pit and come up this way. Then you're doing the other side. So direct vision, looking along the arch from the mesial to do this plane, and then when you're doing this pit, look down the axis, come down to the pit, raise the burr as the distal angle groove is this way. Notice, it's the distal angle groove you're creating. You know the direction it goes, from the middle of the distal to the middle of the lingual. It's not a facial lingual groove. Okay? A lot of times people get confused about the direction of this groove and they put it this way, and then this pit ends up over here. Isn't that amazing? How could the distal pit end up in the central fossa? That's how. If you have the burr going the wrong direction, I've seen it end up in some amazing places. Okay, so look down the axis so you see where you're putting it. Come down the pit, come up this way, flip it over, down the pit, come up this way. Make a really nice groove, very well defined at the bottom, and it rises as it goes toward the lingual cusps. Okay? And then, the easy part that everybody does wrong. I've never figured this out, 30 years. I've never figured out how the easiest part of the occlusal reduction of this prep, the C-plane, how it's way easier than anything else. And it's easier because there's much less to keep track of, and yet everybody does it wrong. It's a mystery to me. Maybe you're going to help me figure it out. So the C-plane, of course, is all the way around here. Here's the C-plane. And all we have to do to get that totally under control, all we have to do to get the perfect vertical angle is point the burr in the right direction. And if I'm looking down the axis, I can see the direction I'm pointing the burr, this way. So I point the burr in this direction. And make a nice groove right here. Cut a nice groove in there. Keep the burr pointing that same direction all the way around here, like this. So the burr is pointing this way here. Pointing this way over here, this way over here, even over here it's pointing this way. All you have to do is look down the axis, you can see the direction you're pointing it, point it this way diagonally, like it's following the distal angle groove that you already started. Cut a groove, a very well-defined groove right there, bang, and then keep it pointing that way all the way around here and up to here, and then into the groove and around here, into the groove and up here, into the groove and around here, into the groove and up here. As long as you're looking down the axis, you can see the direction you're pointing the burr the whole time. Don't be changing it around or anything like that. Just keep it pointing the same direction and do that whole C-plane. It comes out great. It's really, really easy. It's the easiest part of occlusal reduction by far. And yet everybody tends to point the burr this way, facial angle instead of diagonally. I think it probably has a lot to do with people saying, okay, well, this will be easier if I don't use the mirror. Okay, when you get the fact that the mirror is actually your friend, it's your buddy, then you start using it wisely. Look down the axis. So I can see the direction, I can see where the distal angle groove is going, I can see the direction of my burr. Then you find out, oh, that was easy. All you have to do to finish the prep then is just take the burr and come around this corner a little bit. Basically, we're making a nice groove right here and keeping that plane all the way around. Yes, if we're always pointing the burr in the same direction, it forces the burr to be at the right vertical angle, so we don't even have to think about that. Once you come around into the mesial lingual embrasure, it's as long as you're pointing it the same direction, it forces you to be at the right vertical angle, and it always matches the opposing tooth. So in the lower arch, we had to think very carefully about matching the vertical angulation of the A plane to the opposing tooth. The C plane up here, we don't have to think about it at all. It just always works out perfect, as long as we point the burr in the right direction. That's all you have to think about. Point the burr in the right direction, make a good groove, you're good. Doesn't it sound easy? No? No. Well, C-plane's easier than all the rest of it. But again, it's that dance thing, you know? Got to get the dance. So you've been working a little bit on your first steps on the lower molar occlusal reduction. Now we're going to do the upper molar occlusal reduction. I know you haven't mastered the lower one yet. I tease you, say now that we've mastered it, we'll move on to this one. It'll be a while before you master it. You know, you're going to work hard over the weekend doing these things. And we'll make some considerable progress over the weekend and on Monday. But you've got to be paying attention to exactly what it is that I'm suggesting you do, and pay very careful attention to exactly what you're doing. And of course, pay very careful attention to actually how the results were. How did it come out? And now you know how important that is, because when you guys did the A-plane earlier, virtually everybody had the plane, had the grooves completely, if there were grooves, they were completely in the wrong place. You know, I had grooves instead of here, it's way over here, or instead of here, it's way over here. And, you know, pay attention to the fact that probably you didn't notice. Okay? So again, I know what I want to do, I know what it should look like, and I looked at what I did, and I didn't notice that I did it completely off. Okay? So when you start to notice what you actually did, by virtue of breaking it down into all those steps I gave you earlier, and checking each one very carefully, and then you actually notice what you did, and you can do something a little bit different. Make a change. Okay?
Question, so how deep should be the groove on the distal lingual? So when we're taking the bird from the distal...
The groove on the distal lingual. Slow down a little bit.
Preparing the C.
Slow down a little bit. Tell me what you mean by the groove on the distal lingual.
So when we're preparing the C plane, we begin from the distal bit.
So this groove right here?
Yeah.
This groove coming down here?
Yeah.
Okay. So how deep should it be? I don't know. How do we know when we've got it right?
And that's my question. How do we know that the grooves that we made is the correct depth?
Well, it's all depth and position too. But of course, we don't care about the depth, we care about the clearance. So if we're building the crown into occlusion in this area, all we care about is the clearance.
Okay.
And of course, this is a functional cusp, so now we want 1.3 to 1.5. So we want to make sure you have enough clearance. And the contacts, the opposing distal lingual cusp is going to be fitting right in here. And so the C contact is going to be here and here, and we want both of those clearances to be about 1.3 to 1.5. We want to make sure we get enough clearance over the top of this ridge and on this cusp over here. Now, these clearances that we're going to be getting on the functional cusp on the upper arch, you know, we have to realize that we cannot measure them by looking at them directly anymore, because the A-plane, you know, there's not very much clearance there. Seeing past the A-plane and seeing all those lingual cusps, we can't get a ball burnisher back there, we can't see past there. So what do? We use bite wax for the functional cusp. We use bite wax to check the clearance on the B-plane, we use bite wax to check the clearance on the C-plane. We use bite wax to compare these two clearances right here. Again, if those clearances are the same, then we know we have the distal lingual groove in the right location. And if the color of the wax is right, then we know we have enough clearance, and that's what we care about. We don't care how much we reduce it. We care about how much clearance we get, because that's how much gold we get to put on there. And that's what we're trying to control. Okay? All right. How are we doing? Okay, so maybe. We'll see how it goes, right? Now, once we finish the occlusal reduction on the upper prep, and I'll demonstrate it first, then we're going to do the axial reduction on the lingual surface of both of these preps. And then for homework, you're going to do the other two, 14 and 30, and you're going to do the occlusal reduction and the lingual axial reduction. So let's talk about reducing axially. Of course, that has something to do with retention, wall heights, things like that. You have to be careful about the taper. We have to worry about what the margin looks like. We have to worry about how tall the wall is. plenty of things like that. But as we do it, we're going to use a new burr. So we're going to use a burr that has this shape. This will give us a particular type of margin. So as the burr gets to the end, it makes a sharp point. So we have a point right here, or a tip. There's the tip of the burr. This burr is designed, and it's a diamond burr, just like we've been using so far today. It's designed that when we cut into the tooth and the end of the burr, the tip of the burr, gets right to the surface of the tooth here, it's designed that we are going to get a form of our prep that slopes gingerly as it approaches the margin, and that's what we want. We want a prep that slopes gingerly as it approaches the margin. So when the crown seats, it seats at an angle. Instead of being seating like this, it seats at an angle, and geometrically that gives a better marginal adaptation. So I want to have a gentle slope to the prep as it approaches the margin. This burr gives that automatically as long as we reduce axially until the end of the burr gets right to that point right there on the surface of the tooth. So the end of the burr stays at the margin. Okay? What happens if you cut too deep? What happens if you cut too deep axially?
Undercut? Will they get an undercut?
No, won't be an undercut.
You get a wider margin.
What will it be?
Thicker margin or a wider margin?
Yeah, there'll be more axial reduction at the bottom.
Expose the bulb.
What's the shape likely to be?
That's
What's it going to be?
that's
Well, that's going to be up here. What's going to happen at the bottom, at the margin, if we cut too deep this way? Well, you're not going to be that lucky. If you cut too deep, so the end of the burr is inside the tooth, you get that. So we have a name for that, ski jump. Remember the Winter Olympics? Those crazy guys on skis? They're going down this hill, they get to the bottom, they go, whew, flying to there, that's a ski jump. Looks just like this, right? Not quite that steep. All right, so anyway, that's an automatic failure. If you want to fail the prep, make a ski jump. You can make it wherever you want. You can make it on the facial, the lingual, the mesial, the distal, in the corner, whatever. If there's a ski jump anywhere in the prep, it fails. That's it. So obviously we're very concerned about how deep we cut into the tooth. We want to make sure that when the end of the burr gets to the margin right here, we just stop cutting. We don't go any deeper. And some people go 2 or 3 times that deep. They just keep going and going and going and going. And I admit, axial reduction is a lot of fun. It's so pleasurable that sometimes people just can't stop. They get addicted to axial reduction. They just can't stop. They say, okay, I got a beautiful chamfer, but I just can't stop. I got to keep going. It's just so much fun. Yeah, there's that ski jump. Yeah, I got it, but I got to keep going anyway. Okay, my observation seems to suggest that something like that's going on. No, but that's something that you have to deal with in your own head. But now maybe they don't know how deep they are. Maybe somebody's cutting into the tooth and they don't know. They don't know where the end of the burr is. They don't know that, okay, the end of the burr is at the margin, I should stop. They don't know if it's at the margin. So they keep going because they think they haven't gone deep enough yet, but they don't have any way to evaluate how deep they are. Now that sounds equally kind of strange. So we have to kind of figure out when we do this axial reduction, one of the things we know for sure is we have to see where that end of the burr is relative to the surface of the tooth. We have to see how much we reduce axially at the margin. So we have to see that. So for the last several days we've been thinking about, okay, everything we do, there's something we have to see. In this case, when we're doing the axial reduction, whether it's on the lingual surface or through the proximal or whatever, wherever we're doing axial reduction, we have to see where the end of the burr is. Is it at the margin? If it is, we're good. Stop. Now, as we do the axial reduction, what else do we have to see? There are only 3 things that we have to see, but we must see all 3. So as we reduce axially,
Inclination of birth.
the taper. We have to see the taper as well as the amount of axial reduction. So the end of the verb at the margin, that's the amount of axial reduction, the taper. We have to see that also. That's 2 out of 3 things. What's the third thing we have to see? Where we are gingival. So the gingival position, we have to see. The amount of axial reduction, we have to see. The taper, we have to see. Those are the only 3 things that we have to see. That's it. So what's my next question?
How do you see?
How do we see those 3 things? And can we see all 3 of those things at the same time? Ideally, we see them all at the same time. So, okay, so how do we see those 3 things? Good question. What does that always relate to? If it's a matter of how we see something, it's always a matter of which way we look. Okay? So all we have to do is decide, okay, when we're reducing axially around some surface of some tooth, which way do we look while we're doing it? Which way do we look relative to the surface that we're cutting? If we're cutting a surface along this way,
Perpendicular.
so I should do it this way?
Easy to see.
A lot of people do that. It doesn't work, but a lot of people do that. So if I'm cutting a wall like this, and I'm looking perpendicular to it,
No, I mean,
maybe that's not what you meant.
Parallel to the wall.
Parallel to it, okay. But if I do look perpendicular to it, what can I see? So I'm doing this wall like that. What can I see if I'm looking perpendicular to the wall? There are 3 things I have to see. Can I see any of them? Can I see the taper? Can I see the axial reduction?
You can see the gingival margin.
I can see the gingival position. That's it. So if I'm looking perpendicular to the wall, if I'm looking at the wall, I see one of those 3 things. If I'm looking along the wall like this, what can I see? Can I see all 3 of them?
yeah.
I can see the taper, I can see the axial reduction, I see the gingival position. So you have a choice to make. Choice number 1, see one thing out of 3. Choice number 2, see all 3 things out of 3. Okay? So now that's not a difficult choice. But there are times where you kind of get sort of in the middle of doing something and you find yourself reducing like this and thinking it's okay, and until your head clicks in and you say, wait a minute, I can't see 2 of the 3 things, then you got a problem, right? The worst illustration of that I ever saw was I was working with a patient, or working with a student on clinic. I'm going to close that door pretty soon. Can you close the door? Okay, thank you. Okay, so I'm working with a student on clinic, and he's doing a PFM preparation on an upper premolar on a patient. And, you know, I got him started, and then a little bit later he comes back to me and says, would I check his prep? I said, sure. So I'm walking back across the clinic with him, and as we're walking, you always know when the student, you know, thinks they did something wrong, because they try to soften it for you as you're walking. So I remember him saying very, very clearly, and of course I've heard this many, many times, we're walking on, and he says, by the way, then I know we're in trouble. He says, by the way, I think, and I'm saying, oh, now we're really in trouble. He says, by the way, I think I nicked. I'm like, oh, now we're really in trouble. Because, you know, when somebody says they nicked something, it means they totally destroyed it, right? So he says, by the way, I think I nicked. I'm going, okay, what's coming next? The pulp horn. So I don't know what part of the prep he's talking about, but when I go over and sit down with the patient and look at the prep, I see the facial taper. And instead of being like this, now he was doing the face reduction, so instead of having a nice taper like this, it was like this. That much over tapered. So consider that here are the pulp horns, here and here. And he was right. He just barely nicked the pulp horn, but he didn't tell me which one he was talking about. His facial reduction was like this. So he actually nicked, just barely touched the lingual pulp horn. The facial pulp horn was gone miles ago. Okay. So I'm looking at the facial, you know, here's the facial surface of the tooth as he prepped it. and there's this big rectangular hole like this. That was cutting the pulp chamber virtually in half. Okay? So clearly, he was just looking like this, just doing that wall, and he's over-tapering all this, and he had no idea he was over-tapering it. So yeah, if he had been looking along the arch this way, he could have seen the taper and seen exactly what he was doing and saved the patient a lot of trouble. It saved himself a lot of trouble too. Because I had to tell him, I said, when you did the facial reduction, you were looking the wrong direction. Okay? You should have been looking along the wall, and you're looking at the wall. That's why you over-taper. And I say, now I have another direction for you to look. It's down the hall, that way. And you'll see a sign that says endodontic clinic. That's the direction you have to look now. He's going, oh, okay. And of course, he had to pay for the root canal. And of course, the patient should never have had a root canal. So those are the consequences that you can have if you're just looking the wrong way. If you're reducing axially and you're looking at a wall, you don't know how much taper you're doing. You can't see it. You have no idea how much you're reducing. You'll certainly get something like a ski jump a lot of the times. But again, if I'm doing the lingual reduction like this, I'm looking along the wall, I can see the taper, I can see the end of the burr at the margin, I can see the general position, and everything's fine. That's great. So the shape of the burr gives us that. I'm leaning the burr maybe a couple of extra degrees toward the axis. So here's the burr. The burr has a built-in 3-degree taper on each side. So I'll lean it a couple extra degrees. We might have a 5-degree taper, and then if you have two opposing walls, each with a 5-degree taper, you have a 10-degree convergence. Normally we're looking for about a 10 or 12-degree convergence. Now, that's not what the textbooks say. They say 6 degrees. And I still remember the time I was in the international clinic at Loma Linda for a month where I was rotating through that clinic, and there was this guy I'd never worked with before. He'd been a dentist for about 60 years. And he said, why are you trying to get the taper so tight like that? Why are you trying to keep the taper like 6 degrees? I said, that's what the book says. He says, don't ever think about doing that. So this guy had been doing dentistry for a long time, so just taper it, make it easy, okay? It's going to have plenty of retention, and it's easy to see that it draws. 10 or 12 degrees convergence tends to be, better than almost anybody out there. Okay? If you go to a lab and look at their tapers, probably the average is going to be 20 or 25 degrees, maybe 30 degrees, maybe 35 degrees. So, yeah, so don't get too bent out of shape about over-tapering. We're going to be careful about it, but 10 or 12 degrees is fine. Don't get carried away. But again, you've got to know the taper that you're doing while you're doing it. Up here, we're going to take the burr and lean it like this. So get some taper into the burr at the margin in a reasonable place, supragingival in the typodont, keep it a little bit above the gingula. Then we're all set. So now we can look along the tooth that you've just been working on 19, we can look along the arch this way and look pretty much horizontally along the arch on the lingual side, and we can see the taper, we can see the axial reduction, we can see the gingival position. And we're going to bring the chamfer around like this. So have a chamfer margin. It's going to be a little bit of axial reduction, about 0.5 millimeter axial reduction at the margin, at the chamfer. So this is designed to give us about 0.5 millimeter axial reduction. As long as we keep the end of the burr at the margin, we get a nice 0.5 millimeter chamfer, and that's great. That's what we're looking for. Same thing on the upper arch. I can look along the arch on the lower. I can look along the arch on the upper. I looked along the arch by direct vision when I did this. I can use the same direction when I'm cutting along the lingual surface. So I can cut from maybe here, around the lingual surface about like that. I'm erasing the direction of these burrs here. Okay. Don't forget that direction. So now I've got a nice uniform chamfer going around through there. Now we're going to continue the chamfer into the embrasures. So when I do that, so if I'm looking along the arch, if I'm doing the lingual reduction on 19, I'm looking along the arch this way, I can see along the arch. I can do about this much, but when I come around the corners and I get into the embrasure, I have to come around the corner. As I come around the corner, I have to be looking along the wall. So I have to change my viewing direction. Instead of looking along the arch this way, I have to look this way and then look this way and then look this way and then look this way. As I come around that corner, at every point I have to be looking along the wall. So I see those three things. So I'm going to turn my head. I'm going to lean my position a little bit like this. I'm coming around on the distal, coming around the mesial, so I can see those three things all the way into the embrasure on both of these sides. So the work we're going to do now is to come all the way around into those embrasures like this. Now up here on the upper arch, how do you think we're going to come around those corners? How do you think we're going to look along the wall on the upper arch? How are we going to do that? We can look along the upper arch this way. Look along the arch like this to do the direct lingual, and then when I come to the corner, I'm limited in terms of my ability to use direct vision. So the good news is I have a mirror. Put the mirror on the lingual, and I can see all the way around those corners, and I can start to see all these different directions. I can see all these different directions all the way around the corner here, all the way around the corner here. Very easily I can see it along the wall in each of those points. So I'm always seeing along the wall all the way around that corner. Okay? So I'm using the mirror and I'm looking along the wall this way. I'm using the mirror, I'm looking along the wall this way, all the way around that corner. At every point, I can see where I am axially, the taper, and I can see where I am gingerly. Okay? So I'll illustrate that in a few minutes, but that's what I want you to be paying attention to. So this is what we're going to finish today. We're going to finish both of these with the axial reduction around the corner. I'm going to demonstrate it for you immediately, and then you can get started. But again, on the lower arch, I'm going to look across the arch to look around the corner. On the upper arch, I'm going to use the mirror to look around the corner. And in each of the four quadrants, it's a little different. But we always have to be seeing along the wall, whatever wall we're prepping, we have to be looking along the wall so that we can see the axial reduction and the gingival position and the taper. If we don't see any of those things, if we don't see all those things, then we're not in control. Okay? If we do see them, then we're in control and things go quickly and efficiently. That's what we're trying to do. Okay? Sound good? Any questions?
So when we are preparing and doing the axial reduction lingually, so the mirror, like, how do we position the mirror?
We don't.
So it's direct vision?
That's what I was saying.
How, like,
On the lower arch, you know, I'm sitting in the like 8 o'clock chair position. I'm looking along the lingual wall.
yeah.
And I just look right along there, and I can see everything I need to. I'm looking along the wall. Now, I changed my position this way to look across the arch to come around these corners, but that's all direct vision on the lower arch.
But like in the clinical situation, there's
a tongue.
tongues, yeah.
Yeah, so where you use the mirror. I'm sorry, I forgot to mention, we do use the mirror. We use it to retract the tongue.
Yeah.
Now, this guy doesn't have a tongue, so you're lucky.
Yeah.
But yeah, you can use a mirror, but not for helping you see the angles or anything like that. Okay? On the upper arch, you know, I'm looking along the arch this way. At the patient tip back a little bit, I'm leaning over a little bit like that. So I can see I'm looking along the wall. So we're going to use direct vision on the direct lingual along here, but when I come around the corners, seeing all these directions requires using the mirror. But I'll show you how that works. Okay? But again, the bottom line is whatever we're prepping, whatever wall we're prepping, we have to see along the wall. And if you're not conscious about whether you're seeing along the wall, then you always get super over tapered. You just don't want to have this thing happening over here, that's for sure. Okay?